Hey guys, this is Srini, and as you notice, this is not one of my typical Python tutorial videos on image processing. As we're going through this pandemic of coronavirus, or you can call it COVID-19, and COVID-19 stands for Coronavirus Disease 2019 when it first showed up. So as we're going through this, we are asked to obey certain social distancing rules and stay at home, which is again falls under social distancing. And it's very, very important for us as humans to obey these, because by following this social distancing, we will be minimizing the load on our healthcare system. No matter what country you live in, no healthcare system is designed to accept these many patients. So it's very important for us to maintain the social distancing. Now, in this tutorial, I would still use Python because I want to make sure you learn Python while you are at home, working from home, or in general. It's a great skill to add, but I'm going to use that to explain the effect of social distancing on the load that the hospitals are going to take. Okay, so let me again jump onto my screen here, but please obey the rules of social distancing. This is going to save many, many lives. So let's jump onto our Python interface so we can continue this.
In the last couple of weeks, especially in the US, the disease or the virus is spreading pretty rapidly. Now, we know that Italy is a big mess right now. It's overloading their healthcare system. Korea went through this and hopefully they're done. Hopefully they're on the other side of this peak. China also went through this and hopefully they're also on the other side of this peak. Now, I'm afraid that US is actually waiting to see the worst happen. Now, in the last 3 or 4 days itself, the population actually has been doubling almost on a daily basis. I mean, the population that got infected. So if it grows at this rate, then there comes a point where the healthcare system reaches its capacity and it cannot cater to every patient that shows up at their front doors. So, for example, if they can only treat 100 patients and if 1,000 people show up, 900 of us are not going to get the care that we need, which means a fraction of this population is going to go through even worse scenarios, and worst case being death. Of course, none of us want this to happen. This is exactly why the government is trying to take these protective measures, and social distancing is one of these measures. And social distancing is basically minimizing person to person contact so the spreading of the disease becomes less likely in a given amount of time. So eventually, what we are trying to do is instead of rapidly spiking the cases to the point where we break the healthcare system's capacity, we are trying to spread the disease over time. So the healthcare system has enough resources to address every patient that shows up. I hope this makes sense, and let's actually get to the sketchpad where I can actually break this down a little further and talk about the four factors that influence this social distancing and how social distancing can spread the disease over a longer period of time. And first of all, there are four factors, and these are looking at the population that is susceptible to the disease, and then of those, how many are exposed to this virus, and of the exposed ones, how many got infected, and finally, of the infected ones, how many are recovered. So we all go through these four stages as the time goes by. Okay, so let me explain this. And by the way, I should give credit to the to this one blogger, Christian Hubs, and I'm basing most of my discussion based on what he blogged on towardsdatascience.com. I'll probably leave a link to this blog as part of my YouTube video, but he definitely deserves a lot of credit for putting together an amazing blog article on this topic. So let's jump onto this sketchboard. Okay, let's start by writing 4 or 5 equations. And again, for those of you who are not into math, please don't be intimidated. I'll try to make this as plain as possible and try to explain this in plain English as much as possible. Okay, again, so we mentioned, well, that there are four factors that are S. In fact, this is This is called SIR. It's part of the epidemiological model. So if you're into life sciences, you probably know what I'm talking about. Okay, so we have a number of people that are susceptible, and number of people that are exposed to this virus, number of people that are infected, and number of people that are recovered. So these are the four stages. And in this case, we are going to assume that all of these, when you sum these, it equals to the total population of our neighborhood, for example. Okay, so which means we are not accounting for any new babies that are born or any immigrants or someone who is visiting us from outside. So this doesn't account for any of that. This basically says our population is constant. In real life, obviously, that's not the case, right? In real life scenario, the simulations are even a bit more complex. So what do we do with these? So first, let's look at one by one. Okay, let's look at the susceptible. So the change in the number of people that are susceptible to this disease, always in mathematics, the change is represented by delta or D, let's say for easy sake. So ds, the change in the number of people that are susceptible as a function of time. As the time changes in this period of time, how many new people, right? That's all I'm saying. If it is one day, is it 5 people, 10 people, 20? How many people are susceptible? And this is given by an equation. And again, this is part of this model I'm talking about. So if you are interested in where the math came from, of course, you can go ahead and dig it yourself. But this is the equation there. Okay. And why is it this equation from an English point of view? Well, the change in number of people that are susceptible, right? It depends on, for example, the number of infected people. If you have 100 people in the neighborhood and if only one person is infected, then the change in number of susceptible is very minimal. Okay, so it actually depends on number of infected people, and beta here is the average contact rate of the population. Okay, so if the average contact rate is pretty high, then obviously you're going to have a big change in the number of susceptible, and the opposite also true. Yeah, and let's now look at the number of exposed. Pretty much the same thing, dE over dt, because this is a change in number of exposed people. And again, this is given by beta Si, the same thing that we saw up here, minus a new term called alpha and E. And alpha is, I believe it's the, think of this as the inverse of incubation period for this virus. If the virus takes a long time for incubation, then this would be a small number. Okay, for a short time incubation period, that would be a large number. So this is the change in our exposed. Now let's look at the change in our what's the next term? I, right? So in our infected. And as you can imagine, the change in our infected depends on the number of people that are exposed, right? How many people are exposed to this disease and how many people are infected. Okay, and gamma is the inverse of mean infectious period. So if the infectious period is, for example, 10 days, okay, so then gamma is 1 over 10. Okay, and well, we have one more, R. So dr, change in the rate of, change in the number of people that are recovered as a function of time. And this is a fraction of your infected people, right? Some of them are going to be recovered. So these are the primary equations. And again, I should mention that for example, the people exposed to the disease grows with the contact rate, okay, with others, and decreases based on the incubation period. And I also like to reiterate that the change in infected people is based on exposed population and of course and the incubation period. Okay, and this the gamma I already mentioned. It means more people. Yeah, if gamma is high, more people die or recover quickly. Okay, this is just a change in recovery rate. Okay, and we have a fixed population. In addition to this, just to make your life a bit more interesting, I should say, there is another factor called R naught, and there are people actively researching in finding out what these factors are, right? Eventually, we want to find out when this disease is going to go away. And this, in fact, defines how quickly the disease spreads. And for something like measles, the R naught value is pretty high. And for some diseases are very, how should I say, not much infectious. I can't even think of like hepatitis and even Ebola. I think is on the lower side of this contagious thing. Mumps and measles are on the high side of this contagious. So it also depends on obviously how fast the disease spreads. Okay, so here now I think we have everything that we need, and I should also mention where do we get these values from? There are people actively publishing papers. I mean, in fact, there is a paper literally a week ago by Hellewell where he basically mentioned that the incubation period is 5 days. So we right away know what our parameters are, like alpha, for example. Yeah, and R naught value. This value is also given by in the same paper. In a way, I think they mentioned this as 3.5. And there was a different paper that actually mentioned that okay, gamma is about 2 days, or 1 hour gamma I mean is 2 days, so gamma would be 0 0.5. Okay, and also they also mentioned the beta values. So all we are going to do is just put these equations in Python and then just generate our graphs. That's it. Okay, so let me just go ahead and show you the code right away because I don't want to go ahead and type it. I'm going to share the code anyhow on my GitHub page. So let's jump to Spider IDE so we can just look at this graph. Okay, so here is our IDE, and instead of just loading the entire file, I want to paste a few lines at a time for those of you who are new to coding. Okay, so first of all, let's import the required libraries. We're going to use NumPy to manipulate, to manage, to play with our numbers, and matplotlib pyplot to do the plotting at the end. So let's go ahead and start defining our parameters. The maximum time is how long do we want to do this simulation for, okay? So I'm leaving it to 120 days because after 120 days, again, we are on the other side of this curve. And change in my time. Remember this dt right there. So the change in time or the time steps that I want to simulate for is 0.1 in terms of days. Okay, so now let's go ahead and create certain, these time steps. And the way you do that is in NumPy, you can create a linspace. With using linspace, you can actually create the time data points from 0 to whatever the maximum time point is. And let's fix our total population to 10,000 people. Okay, and let's actually initialize our values, because for any simulation you need to start with what are the initial values. Okay, so the way I want to define here is my initial values is 1 minus 1 over n, and so use I'm using the normalized population. Okay, and again, not going deep into the math. If we begin with one exposed person out of 10,000, that means remaining 9,999 are susceptible. That's exactly what this is. Okay, what I'm saying is my S, the susceptible, is 9,999 people, and 1 over n is the next one, the exposed, and then 0 and 0 for my infected and recovered. Okay, so this is where I would like to start. Again, these are only initial values, right? And then let's actually keep our incubation days like published in the paper. So which means our alpha is 0.2. In the paper, again, I did mention that this alpha value, they defined this incubate, which is nothing but 1 over the incubation period. Okay, so in the paper they mentioned that it is 2 days, 5 days, sorry. So which means our alpha is 0.2, and gamma would be 0.5. Again, from another paper, I'll leave the links as part of this video on YouTube, and our beta equals to 1.75. And how did we get our beta? This is actually calculated based on this equation. Yeah, because we know what R naught is from this published paper, and we know what gamma is. So we are kind of calculating this beta based on that. Okay. What else do we have? I think this is pretty much it. And did I mention about rho? No, that would be uh, that's a in fact that is the entire video is about social distancing. Now, so far I didn't talk about I didn't talk about social distancing, right? So if we introduce a factor called rho, it's written right that. Okay, this captures the social distancing effect. Okay, and if this value is equal to 0, that means everyone is locked down. No one's contacting anyone else. No one's touching anyone else. Okay, if this value is equal to 1, this is equal to what I just mentioned here. If rho is equal to 1, that means the life is normal. Everyone has equal probability of contacting everyone else. Okay, so to modify these equations, I'm just going to multiply this by rho. I am going to multiply this by rho. So these are, again, these two terms, well, sorry, this one term of rho is the social distancing effect. So we need to define that, but let's get back to the code. So I want to define this rho, but what we'll do for now is, instead of defining it once, let's actually put that in a loop so we can calculate our effects by changing the rho value. Okay, so let me calculate the rest of this code. Again, this is where I may lose some of you who are non-coders, but please learn coding. It really, really helps you, your future. Okay, no matter what your background is, humanities, whatever. There are applications for coding in every field. Okay, so let me get back here. So I'm defining that my parameters are alpha, beta, and gamma, right? Alpha, beta, and gamma. And then I'm creating a function, so I don't have to write this code every time I want to run it. So I'm putting it in a function, so I can call it later on any number of times. So the function is basically saying that, okay, take these as inputs, and these are my initial values. Okay, and my alpha, beta, gamma are parameters. See, my parameters I defined as alpha, beta, gamma. All I'm doing is unwrapping it in here, and then my change in time is nothing but time now minus time before. Okay, so that's what this line is, and then I put this in a for loop. Okay, so these are basically our equations. Okay, so next s is nothing but our delta s, or ds. Yeah, ds is what? Minus beta si delta and or rho, and times dt. That's all this is. Okay, times dt. Okay, so all I'm doing here is, again, I'll share the code, or you can pause the video, you can study this, but all of these is basically what we have written down in the form of equations over there. And after every calculation, we are basically appending those values into a list. In other words, think of creating again, for those of you who are non-programmers, initially my s is equal to, I start off with some value, okay? And then the next time I add another value. Next time I add another value. So this is how I'm actually creating a list of s values and e values and I and r values. So eventually we can go ahead and plot them. Okay, so this is the code, and I'll actually, when I share the code, I'll write as much text as possible. So even if you're not a coder, you should be able to hopefully at least follow the code. Okay, and the rest of it is basically plotting it. Now that I have everything, let me go ahead and plot, but I'll explain just a second. Again, here, so I'm using the pandas library to manage this, the numbers that I'm getting out of this code. And here I'm actually, remember I said, okay, this is a function, so I can call it any number of times. That's exactly what I'm doing here. I'm calling that function how many times? 1, 2, 3 times. 1 for a value of 1 for row, 0.8, and 0.6. Again, 1 means no social distancing at all. Zero point 0.8 means about 20% social distancing. 0.6 means about 40% social distancing. Okay, so let's see the effect of social distancing by plotting values for what are we plotting? Exposed and infected populations. Okay, exposed and infected populations for a value of 1, for a row value of 1, 0.8, and 0.6. Let's go ahead and run this and look at the result on the right hand side. So here you see the blue curves here are for the exposed population, and the green curves are for the infected population. As you see, right here, we are in a way think of this as a peak infection rate. Okay, it's actually going from 10% of the population being infected with social distancing of about 0.4. I mean, with a rho value of 0.6, we actually brought that 10% down to about 4% or 4.5% down here. That means if our hospital's capacity is to take about 5 patients or 5% of the population, then by minimizing it, by keeping it below the 5% level, we will be saving valuable lives. Okay, again, the exposed and infected all are related. Now, please focus on this infected rate. Okay, 10% of the population versus 8% versus 4.5%. Such a big difference in some individual's life who is going to get the care that they deserve, that they need at the healthcare facility. So I hope with this tutorial you at least learned the importance of social distancing and also at the same time appreciated the simplicity of Python and how Python can be used for everyday scenarios. Okay, so for those non-coders watching this tutorial, I definitely encourage you to learn how to code because this is going to help you in future for sure. This is very easy. Okay, so thank you very much for watching this tutorial. I hope you found this useful. And in my next tutorial, I'm going to go back to my regular Python training. So if you haven't already subscribed to my channel, please subscribe to it. It's Python for Microscopists on YouTube. Thank you very much.